Hi, Mr. Smith. I'm Violet. I'm going to be your student nurse. I'm going to close your screen for privacy. Can you verify your name and date of birth? Great. Today we're going to be doing some trach care and suctioning. I heard you might be a little congested. If you have any respiratory distress at any time during this, please raise your hand high so I can see it. I'm going to begin by raising your bed, and I'm going to listen to your lung sounds so that I can hear if you are in respiratory distress. I'm going to put on clean gloves before I do this. Breathe normally. You do sound a little congested. I'm also going to test your pulse ox, and if it's low, that would tell me that you are not having proper oxygenation. I'm going to check your suction, and it's at 500, so that's good, or 150. And then I'm checking your oxygen that was set right to 10 to 15 liters, so that's good. Before we start, I'm going to make sure that this suction's working after I removed it, and it is. Okay, now I'm going to begin to set up my field so that we can begin suctioning. I'm going to place this straight down so we don't get any sputum on you. Sputum. First, I'm going to put on my goggles and my face shield. If you don't mind, I'm going to set this in blue bag right here. Okay, I'm going to start by opening my materials. Not like that. Sorry, sliding them onto the table. I'm touching the outer corner, get those away. Put my gloves. I'm gonna first set this up, dump the first out, and dump the water in there. Okay. I'm going to now put on my pair of gloves. Okay. And I'm going to only touch the inside of the bag. Okay, I have to get all of that. Okay. And I'm going to put it around my right hand, which is my dominant hand. Now this hand is going to become my dirty hand. I'm going to make sure that the suction is working, and then I'm going to connect it, check the suction again, and it is connected. Before I begin, I'm going to put it in the water and give some breaths. While I do this, if you have any respiratory distress, raise your hand, and also if you could cough while I'm suctioning. I'm going to give you some breaths. Try to cough. I'm doing this for no more than 10 to 15 seconds. Dip. And I am going to do it one more time. Cough. Dip. And now I'm going to suction the mouth. Great. And provide oral care. Now at this time, I'm going to grab the dirty old cannula, remove this, throw this away. I forgot to give breaths between each section, so I should have done that. Put this away. I'm gonna reapply oxygen at this time if needed. And now I'm gonna begin setting up to change for my inner cannula, my change of inner cannula. Okay, for my sterile field, I'm going to first grab my one quarter this way. Now I'm going to open my neck. Set this outside the sterile field since I touched the outside. I'm going to dump some water out, dump this in here, open my new cannula, put it in the water, open my Trache collar, and a thing for oral care. Now I'm going to don my sterile gloves and perform hand hygiene to begin the change of the inner cannula. Okay. Now I can touch inside my kit. I'm going to put the cannula in by holding the outside. I'm holding it with this hand, and I'm going to twist it in, rotating it. This one doesn't fit my mannequin, but I put the cannula in. Now I can break sterility. The cannula's in. I could have used this to create a bigger sterile field. I'm going to place it under my patient. Keep it from getting wet. I'm going to remove the old bandage. Now I'm going to take my Q-tips and one side, throw it away, one side, throw it away, one side, throw it away, all the sides. Now I'm going to replace the gauze. And put on my new trig collar. By holding it with the other hand while I do so. Bring it around the neck. Stabilize it for a moment. Try to ask my patients to move forward, and this would be a lot easier. This one. I'm going to make sure that all oxygen is reapplied and suction is reapplied, and that the oxygen is 1 to 5 and suction is the ordered amount. Before I leave, I am going to re-listen for lung sounds to make sure that we cleared the decongestion as our purpose. I'm also going to put my finger in to make sure that there's room from the neck. 2 fingers. Okay, listen on the back. And I'll keep a note on his pulse oximetry to make sure he's getting oxygenated. Thank you, Mr. Smith. I'm going to lower your bed. I could also provide oral care if needed. And perform hand hygiene. Thank you, Mr. Smith.